All right, welcome everybody, and hello, my name is Vincent Weir, and I am a general partner and the chairman of Nordic Science Capital, which is an early stage biotech incubation fund. And I'm super excited to be with this great group tonight because at Nordic Science Capital, our mission is to help 1 billion people live longer lives. And of course, we talk about saving lives since we're working on problems like cancer vaccines and tuberculosis diagnostic tests, small molecules to prevent vector-borne diseases like malaria and dengue. But at the end of the day, saving a life just means extending it. And indeed, Nordic Science Capital is getting at like one of the interesting reasons why we're all here tonight. The history of capitalism and science are essentially contemporary. They're contemporary phenomenon, and they have been working together for the last 200 or 300 years to achieve amazing results for humans. So in this last 100 years alone, we have 7x'd the wealth of the average person on Earth, while cutting our average work week in half. And as we make more money, what is something that happens? We live longer. So in the same time period, our average life expectancy has more than doubled. We've added 40 plus years to the average human life. And one interesting phenomenon here is that it is often the capitalists, those of us that venture into the unknown, that are willing to experiment, that are willing to fund the incredible work that is very expensive at first. We are the ones that push these fields forward. And that's been true of everything from the dialysis to, of course, gene and cell therapies today, but also vaccines originated with the wealthy and those that had the ability to take this new experimental technology seriously. And of course, as a result, we've been able to save the lives of billions as a result of these technologies. So here we stand today at this interesting moment where we can look from the top of the mountain and see some of the amazing work that's been done. We have some truly world experts here to discuss some of the breakthroughs that they have either pioneered or certainly studied in depth and done amazing trial work on. And we're going to talk about some of the possibilities that face us today at the kind of cutting edge of this quest that we have been on for really ever as humans to continue to live longer, better, healthier lives. So with that, I want to introduce our first guest. She is the in-house physician of the HBOT Co. Stockholm. She is a researcher with decades of clinical and academic experience. She's trained at Uppsala, Karolinska, Harvard, and Sahlgrenska, and she has served as chief medical officer of a leading women's health clinic in Stockholm before becoming the pioneer of preventative and longevity-focused medicine. Welcome, Dr. Nathalie Helm.
HBOT Co. What do we stand for? Access, biology, control. Access beyond ordinary care. Access to advanced therapies that can help to regenerate health and that are safe and well studied. Access also meaning closeness. We're located in the middle of Stockholm and some of our most advanced programs in Istanbul. Biology. Every program is built around your body's unique system and goals. We work with programs using regenerative therapies such as stem cells, exosomes, hyperbaric oxygen to reduce pain, help with recovery and resilience, and optimum health. Control. Everything we do is measured, tracked, and optimized, from biomarkers to performance, before and after treatment. And the programs are individualized based on your personal needs. Why am I here? I wanted to move from giving diagnosis to patients and pills to relieve their symptoms. You can argue that functional medicine, which I've been practicing for the last 7 years, is longevity medicine. In functional medicine, we're really trying to find the root cause of any health issue and treat the cause, not the symptoms. This is how we really can affect our aging in the right way to prevent diseases from occurring and thus affect longevity. So for me, as a traditionally trained medical doctor and researcher, and further trained in functional medicine, I now have a much bigger toolbox, which I can use to help my patients and clients, especially now with all the different regenerative therapies available, and a deeper understanding of what is really driving aging and as a consequence, the development of chronic disease. And I just want to remind you that when we talk about longevity, we're not talking about just living as long as possible along the red line on this graph. This is what conventional medicine is working on right now. We talk about living healthy as long as possible along the green line on this graph, with a functioning body, a sharp mind, and high quality of life. The thing is, chronic disease do not occur in a matter of minutes or even days. They develop usually over decades. It is a lifetime of wear and tear and accumulation of inflammation from a variety of sources. The pictures shows how you can move from wellness to illness and backwards. Symptoms develop when you move from the green to the yellow. We're all somewhere on this line. It is easy to associate lack of symptoms with being well, but many of us are at best in the green comfort zone. Some people know where they are along this line, perhaps because they have been diagnosed with a disease. Most people don't. They just assume they are healthy. By the way, do you know that about half of people who die from coronary heart disease did not have any symptoms before they suddenly died? So we want to help you look under the hood and really define where you are on the health continuum and start moving you in the right direction. We want to age while still maintaining our health and quality of life. And for this, we need to know the underlying processes. And as a matter of fact, we know about these processes. The 12 hallmarks of aging has been identified as part of the aging process. I'm not going to go through all of these, but I'd just like to highlight a few that for the topic of today's discussion are of extra interest. One of them is epigenetic alteration, which means that how our environment, everything that we are exposed to, affect which genes are expressed in our cells, and ultimately how we respond to stimuli from our environment. You will hear later on that hyperbaric oxygen treatment has a huge impact on epigenetic signaling in our cells. The second is mitochondrial dysfunction. Our mitochondria, our power station in our cells, are of utmost importance to our health. They are responsible for creating energy in almost all our 37 billion cells using oxygen and nutrients in order to keep 1.8 quadrillion reactions going on per second in your body. So we're all pretty busy right now. You will hear more about the importance from Dr. Sonners. The third one is stem cell exhaustion. Part of aging is also aging stem cells. They become less efficient to heal our body. So of course, helping to boost the ones we still have, or adding new ones can be a good option to slow aging. And the fourth is chronic inflammation. With age, a slow, smoldering chronic inflammation is often started. This is termed inflammaging. Every chronic disease is both caused by and causes inflammation in the body. And all the other hallmarks of aging are keeping the inflammation going. So all these 12 hallmarks of aging, and there may be more, are interconnected and affect each other and will in the end become a perfect storm inside to accelerate aging and move us in the wrong way on the health continuum that I previously discussed. So this is where regenerative medicine comes in. Are there anyone in the audience that would like to have an extraordinary health and outstanding energy? Ah. Are there anyone with pain somewhere in the body? Ah. For those of us who are not living in a blue zone, walking barefoot in the nation, getting right amount of sunlight, eating only unprocessed food, having low exposure to stress and environmental toxins, lots of movement, enough time for resilience. Well, for those of us who are not, what can we do apart from eating as healthy we can, move our bodies, prioritize sleep, healthy relationships? Well, we need to work on our regeneration. We need help to move in the right direction. So our goal is to improve health in a safe way, and for this we need a multi-therapeutic approach. You will soon hear Dr. Sonners describe the fantastic regenerative potential of breathing oxygen under pressure in an hyperbaric chamber. And we will later come back to our programs where we combined hyperbaric oxygen therapy to other regenerative therapies, such as mesenchymal stem cells, exosomes, plasmapheresis, peptide, to potentiate the regenerative effects. By this, I'd like to leave over to Dr. Sonners.
Thank you so much, Nathalie. And it's great to see such a comprehensive approach and obviously the basis of your work here at HBOT Co. Stockholm. So our next guest would love to introduce one of the world's leading experts on hyperbaric oxygen therapy, Dr. Jason Sonners. He's not only one of the leading experts in this space, but he's also published 2 seminal books. He's completed his PhD in molecular biology. He is one of the global advocates for the effectiveness of hyperbaric treatments, and his research and teaching, they talk about integrating this into mainstream healthcare and unlocking the potential of this very ancient, as we'll learn, therapy method for trauma recovery, neurodegeneration, and longevity itself. Welcome, Dr. Jason Sonners.
Thank you. I appreciate that. Thank you much. So, before we get too far into the weeds on hyperbaric, which we will a little bit, I still want to stay a little bit more 30,000-foot view and talk a little bit about why hyperbaric is actually going to end up helping so many different people for so many different reasons, but also why we're combining so many different therapies in tandem with one another as we're trying to navigate this regenerative space. So, Nathalie asked, who's interested? So just who is interested in a healthy living? I just wanted to make sure, because I didn't see everybody's hand. So if I'm in the wrong place, I could definitely go back to, Miami. But, this is a very difficult place to function as a physician, because we're used to, people come in when there's a problem, we discuss what the problem is, and then we try to problem solve and look for solutions. But as we talked about the health continuum, which we'll talk about again in a moment, there are things happening inside of our bodies all of the time. Some of those are very positive and improving our health on a regular basis, and some of those are really eating away at us and breaking us down, but don't necessarily scream. You're not always aware of what's going on inside your body. So how many of you think that the world is more stressful than perhaps the world we were designed to live in? Anybody? Or is that just an American thing? Who thinks the world's more toxic than the world that we potentially were designed to function in? And so this conversation about health and longevity, people blame a lot on age. Oh, that's normal for you for your age. Oh, that happens. Oh, wait till you turn fill in the blank, then you'll see what really happens, right? So we tend to blame a lot on age, but even something simple, let's say, who here has had a knee problem or a hip problem or a shoulder, any joint issues in the room? So we go and get an x-ray or an MRI, right? And there might be some wear and tear. And so you see this wear and tear, let's just say, like I had right shoulder issues, right? So you have this wear and tear on your right shoulder, and you take a comparative study to the other side so that you can see what's going on inside somebody's body. So is it possible that I could have one shoulder that looks pretty terrible, pretty beat up, and one shoulder that looks actually relatively well? Yes? Mm-hmm. How old are my shoulders? Are they the same age or are they different ages? Because if it's normal for my age, then both of those shoulders should look identical. Meanwhile, in many cases, I'm sure you can relate, they don't. And so this isn't a process of just aging. This is a process of what I consider to be accelerated aging. And accelerated aging, to me, we're all going to be aged. And anti-aging is not really the term I like to use or talk about, though it's one that's thrown around out there. Aging is the goal. But it's healthy aging that is the goal, right? So it's not an anti-aging phenomenon, it's a healthy aging phenomenon. And aging is multidimensional. Accelerated aging comes from many different sources. And health comes from many different sources. I wouldn't even say that these are all inclusive, but just to give you an idea, in order to truly be healthy, clean air, clean water, clean food. Do we have clean air all the time? Do we have clean water all the time? Do we have clean food all the time? I mean, I'm just getting started and we're already shaking our head no, right? So this is the challenge that many of us are really facing. Good energy, quality sleep, exercise, balanced hormones, immune system, healthy gut, emotional well-being. All of these have to come together and come together at the same time to actually start moving our health in the direction that we want. Sometimes it's really nice, just as like a personal assessment, to go and look at different areas like this and be like, well, I do have a really good water filter on my house. Okay, so I'm doing something for that. I am trying to get some exercise, but man, my sleep is pretty terrible and I get sick all the time. Well, okay, so here are some areas where you could start keying in. Well, those are clear, weaknesses, let's just say, in your multidimensional health picture that deserve some time, attention, and some focus, right? So even just a health assessment of your own to assess your life could be helpful that way. And Nathalie showed this. Has anyone in this room been affected personally or a loved one with heart disease? Cancer? Stroke? Diabetes? Okay. What's the first sign of a stroke? Slurred speech, drooping mouth, drooping eyelid. What's happening if that's happening? You're having a stroke. What's the first sign of a heart attack? Difficulty breathing, chest pain, arm pain. What's happening if you're having that? You're having a heart attack. The first sign of a stroke is a stroke. And the first sign of a heart attack is a heart attack. The first sign of cancer is usually some sort of pain or obstruction that's creating some massive change physiologically for that person, by which time you're already far down that grading system inside of cancer and becoming symptomatic, because cancer itself is asymptomatic. And so the point of this is to really understand that a lot of people, if you just say, hey, how you doing? I don't know if that's how you guys say it, but that's how we say, hey, how you doing? People are like, oh, I'm good, I'm fine, I feel good, right? But meanwhile, you could have asked anybody, let's say that had a heart attack on a Wednesday, how they felt on Tuesday, and they would have given you that same answer. And so just gauging how are you and how you feel, or what your new normal is. In other words, I would argue that most of us are not as healthy as we could be. And many of us have just decided that, like, well, I went to a few doctors, they told me like this fatigue and this pain and these issues with my sleep. It's like, oh, that's just normal for my age, so I guess this is as good as it gets. And we just kind of like assume that aging is supposed to break us down, that things are supposed to go wrong, and everybody else must be feeling the same way, and so we push through. Meanwhile, our quality of life is sinking that entire time. And as that's happening, you're shifting from 6 to 5 to 4, right? It's not until you really start to show pretty significant signs and symptoms of disease where we could start to actually like diagnose something. But certainly a lot of people are living in the middle of that, thinking they're doing okay, but slowly sliding backwards. Likewise, there's an enormous difference between being asymptomatic and being well. Does that make sense? Somebody can say, hey, I have nothing to complain about. I don't have any pain. I think my energy's okay. I wake up, I go to work, I'm a father, I'm a husband, I'm a professional, I do all the things I'm supposed to do. But is it possible that that person could be like let's say a 7, right? They're okay, they're asymptomatic, but there's still room for improvement. Does that make sense to everybody? My argument would be it doesn't actually matter where you are. Health is dynamic, it's constantly changing. And everything that we do or don't do throughout the course of our life is moving us one way or the other. Is there anybody in here that's like every decision that they've ever made has only been a positive, healthy decision and they're peaking at 10? Like, no, that doesn't exist. But I like to tell patients, even if only 51% of your decision-making matrix was healthy and positive, it would take a long time, but slowly you'd be at least moving in the right direction. I believe that most people, if I took a net result of the lifestyle, their environment, the decision-making, all the pieces that we looked at in the beginning of those pillars of health, that 51 or more % are actually on the negative. And so that's why they're sliding backwards on that scale over time. And so essentially that's just to say that, just because you're not sick doesn't mean that you're actually well. And that's an important for those of you that are doing moderately well but looking for optimization. understand that the more optimum you become is just the more resilient. You're familiar with Darwin? What did Darwin say? Survival of the fittest. People think that that means like the fittest, like the strongest. That's not what that meant. Survival of the fittest actually was referring to an animal's ability to adapt. And to adapt to an ever-changing environment. Do you live in an ever-changing environment that you have very little control over? Yes. And so your health is related to your fitness, or your ability to adapt and become resilient to this ever-changing environment that's being thrusted upon you that unfortunately we don't have a lot of control over, but we can control the things that we're doing in our life to improve our adaptation ability. So that's really what we're looking for. And again, just for those that might be challenged with something as far as their health goes, just because you do have a diagnosis, just because you are health challenged and having an issue that you're facing right now, or a loved one that's facing right now, doesn't mean that you can't move back in the right direction. As long as you're alive, the body is always looking for balance, it's always looking for health. And it's just a question of getting rid of the certain ingredients that it has that it needs to get rid of, or putting back a lot of the ingredients that maybe we're missing. Obviously, I'm simplifying it a great deal. However, I actually do believe it's pretty much that simple if we could do the detective work to figure it out. So, I'm going to take you on a thought journey, okay? I guess I still am, but I was a clinician for about 20 years. I practiced functional medicine most, 18 of that 20 years essentially. And for me, if somebody brought me a tool or a therapy or a strategy, if I didn't think it would hurt them and I thought it might help them, I would use it. Fast forward a whole bunch of years, I decided to go back as an old man and go get a PhD in molecular biology. And as a researcher, that's not how you would do things. You'd be like, well, if it's not proven, how could you apply it? That's the wrong thing to do, right? So now I have these two voices on my shoulder. It's not a devil and an angel. It's just a clinician and a researcher that's always arguing, like, should we try this? Should we not try it? How do we do it in the safest, most effective, most therapeutic way? So, but I believe that the relying wholly on the literature for our rationale of whether we're going to apply a therapy or not, A, is very misleading, and B, would just take too much time. When sailors leaving Europe were, crossing the Atlantic Ocean, do you know what they suffered from? What was the main health issue crossing the Atlantic, right? Scurvy. From 1500 to 1800, 300 years, it took between starting to see signs and symptoms of scurvy and the first experiment by James Lind to describe that actually citrus fruit, we didn't know why, but citrus fruit reduces the likelihood and the incidences of scurvy. 300 years before the British Navy was like, oh, we need to start doing this. It then took another 100 years before vitamin C was discovered. Science moves a little bit faster today than it did back then, but not much. Okay? The average to go from a standard research lab into clinical practice is on average 17 to 24 years. Okay? So if we're going to sit idly by and wait for every single thing to be proven out on a double-blind controlled randomized basis, we're going to be missing out. But you can't just haphazardly make those decisions. They have to be founded in something regarding safety and efficacy. Make sense? So we're going to go on this little journey together. You go to a store. You guys have such beautiful green, lush land around here. It's incredible. So you go to the store and you buy this beautiful plant, healthy as can be. Anyone have plants in their house? Okay? You take it home, 3 weeks later, it looks like this. That's what happens to my house. Even in Miami, we still have that happen. What happened? It's dying. Still, I don't think it's dead yet, but it's dying. Why? It was healthy when you bought it, and now does it look as healthy as it was? No. What's your first thought? Give me some thoughts.
Water.
Okay, water. What else? Nutrition. Sunlight.
Love.
You guys might be some sunlight deficient in these parts sometimes, right? What else?
Love.
Love. I love that. That's a great one. right? So what are you doing? You're like, hey, if you think you figured out the right ingredient and you put the right ingredient back in that plant, should it come back?
Yes.
Right? Is that your experience? That's been my experience. Why isn't anyone like, it's probably got this rare genetic mutation that occurred as you brought it home from the store? Or, oh, you know, maybe if we just injected it with like a polymer glue and we could make it stand up again and like spray paint it green. Would you do that? No. You're immediately going through your thought process of what makes a plant healthy. And I bet it's either getting too much of something that it shouldn't be getting, or it's not getting enough of something that it needs. And you went through that process yourself. But for some reason, when we talk about human health, we start to panic and start thinking outside of that thought process. And quite honestly, it is that simple. So here's what we have to do. In order to find out why that plant got sick, we're going to do a double-blind controlled randomized study. If you're not familiar, I will talk a little bit about it. We just kind of went through that, so I'm just cruising through. Right? Doesn't have a genetic disease. So we're going to do a double-blind prospective crossover study. We have to control for all the other factors, right? Because we have to make sure that the intervention that we're choosing to use is the intervention that's creating the benefit. Does that make sense? We want to make that plant healthy again, so we have to do a perfect study. We're going to do each intervention for 2 weeks, and then we're going to measure the outcome and come up with an answer. Got it? So in a study, it would look something like this. We can't do one plant, right? So we're actually going to get 5 plants. We're going to have a water group, a sunlight group. You guys decided these, I didn't, right? Food group, and a soil group. And then we need a control group, right? The control group would say, hey, we didn't do anything to this plant. So we have to make sure if we do nothing, it stays sick, right? And then we're going to do water, sunlight, food, and soil. But you have to control for the variables. So the group that gets water has to go in a closet. It can't get any sunlight because we need to make sure that the water is the intervention. We're not going to feed it. And we're certainly not going to change its soil, even if the soil was toxic. The sunlight group's going to get tons of sunlight, because we know, raise your hand if you think sunlight's important for plants. Right? We're going to get tons of sunlight, but we're not going to water it. We're certainly not going to feed it, and we aren't going to change the soil. The food group's going to get fed in a closet without any water, and we're not going to change its soil. And the soil group is going to have brand new, fresh, beautiful, delicious soil, but no food, no sunlight, and no water. Okay? That is a perfect RCT. Okay? What do you think is going to happen? I mean, do I even have to go through it? But I will, because I really want you to drive this home, right? So, 2 weeks of water only. The soil was dry, and it needed water. Would water be good for that plant? 100% of the time, right? So you could even say, wow, the soil was super dry. As we added water, it really got nice and moist. That's exactly what we would have thought it. However, the plant still continued to droop. So water is not essential for this plant's health. That would be the result of that research project. How about sunlight? So it was already dry. We didn't add any water, and we just put it, like you shipped it to me in Miami, I put it full sun. How's that thing going to look? It's actually going to look worse, right? Now it's totally dried out, it's brown, it's cracking, breaking, and falling apart. Not only, the results would be, not only is sunlight not important for plants' health, actually it seemed to make the plant even sicker, and it killed the plant. Do you understand? That's how science is done. I'm kind of exaggerating, I'm kind of making light of it, but actually not really. That is how things have to be. And so, if we start to isolate certain areas like this, and what do you do in your health? I have patients who come to me, they're like, let's just say it was food. Well, I thought maybe I was like gluten intolerance, right? I thought maybe it was gluten, maybe it was dairy, I don't know. So I took gluten out of my diet for a month. It didn't seem to do anything, so I put it back. And then I took dairy out for a little while. That didn't seem to do anything either. So now I just put them both back, and I don't think it was food. But is it possible that both of them could have been causing that person problems, right? Or, well, I want to try this new supplement that I heard is on the market, and it might be really good for me, right? I don't know, vitamin D, right? So I'm taking vitamin D, but like, hey, are you sufficient in, let's just say, vitamin K? Because you need both in order to absorb both. And so you took all the vitamin D on planet Earth, but your numbers still stayed low, or you still had the same problems because you didn't understand the synergy between different components. Do you understand? Incredibly important when it comes to human health, even plant health. But I'm more worried about you guys than I am about that plant. So again, we already kind of went over that, so I'm just going to cruise through. But, you know, why don't we evaluate our own health when we go to the doctor or when we're treating people? Like, why can't we just start to just think a little bit more this way and understand that individual therapies often actually work? Like I'm saying, like I'm telling you, the sunlight would just kill the plant. Like a lot of times when we choose individual therapies, we get some result. Sometimes we don't get any, but a lot of times we do. But is it also possible that if we did combine the right pieces, then that result would have been magnified? In fact, in my office, we talk about synergy, and as we're talking about the protocols that are being offered here, the synergy, in other words, that the result of combining therapies is greater than any one of them could have been on their own. And that's the kind of impact that we're looking for as we build these out. So I would say, and this goes back to the hallmarks of aging as we were talking about before, but I would say when it comes to human health, and that's again, it doesn't, to me it doesn't matter if someone is unhealthy and diagnosed and trying to at least become asymptomatic, or someone's doing well and wants to optimize. The ingredients that make a healthy human healthy are the same no matter where you are on that continuum. Does that make sense to you? Yep. Like, did the plant that's like almost dead need different ingredients than the plant that just started to droop? Or did they just need the same exact ingredients? Now, the intensity of those ingredients, the frequency of those ingredients, the duration that you'd have to give those ingredients, that's where the changes would really occur. But the physical ingredients to make a plant healthy are the same physical ingredients that make that plant healthy 100% of the time. Humans are more complicated than plants, but essentially that thought is still very similar. So I'm looking at how do we take a human and improve their health no matter where they are on that continuum. I would say based on the hallmarks of aging and really what we consider to be the pillars of chronic illness, there are three main areas to deal with. Chronic inflammation. Again, that goes back to when I was asking you about, are we living in a more toxic environment than we once did? Are we living in a more stressful environment than what we were designed to tolerate once upon a time? Raise your hand if you think you might be mildly more inflamed than maybe you ought to be. Like, I know I am. So how do we get inflammation? That's one of the key ingredients across the board for every human to improve their health. Reducing inflammation will improve everybody's health almost immediately. Mitochondrial dysfunction, what does that mean? The mitochondria, as Nathalie said earlier, that's basically how your cells are making energy. And if you want your cells to do whatever job they're supposed to do, that might mean for your liver to detoxify, or for your intestines to absorb nutrients, or for your brain to think these beautiful thoughts or understand what I'm talking about or have clarity or creativity. All of that requires cellular energy. And the mitochondria's health is really what determines the amount of energy your cells could produce to do their job. Who here has all the energy that they've ever wanted and then some, and actually they have some extra that they're willing to just start handing out? Right? We could all use a boost. And so mitochondrial energy production is different than the energy that you just happen to feel, but it plays a really big part in that whole journey. And if we want to improve our performance in our life or in our health, creating more cellular energy is absolutely one of those pieces. And then stem cell mobilization, because stem cells is how you regenerate and renew your tissues, right? There's arguments for how many cells are made up, that were made up. So I'm gonna pick 70 trillion. Okay, so you're 70 trillion cells working in concert in order to sit here and be one organism. That's a lot, by the way, if you're not familiar. It's a lot of cells. But you're not the same you might be the same number of cells, but you're not the same actual cells. Over time, those cells need to renew. Are you aware of this? Skin cells renew very quickly, like literally almost daily. Red blood cells renew every 4 months, 3 months. neurons, but very, very slowly. So different cells regenerate at different rates. But the you that we recognize when we see you is not the you cellularly 10 minutes ago, let alone 2 hours ago, let alone 10 years ago. And it won't be into the future either. And your ability to continually renew yourself has everything to do with your ability to manufacture, maintain, and mobilize stem cells as necessary. So we compare that to the salamander. If you're familiar, when a salamander loses a leg or the salamander loses a tail, they regrow them. What we're trying to do is turn you into a salamander. Not really. We will not regenerate arms and legs the way they do, but one of the ways that we can really understand how are they able to do that? Because I don't know about, I mean, you might not nerd out on these things as much as I do, but I'm like, if we can tap into whatever that salamander is doing and even get a fraction of it, we can start regenerating things exponentially better than we ever have. So like, what do they do? What do they have that we can't or don't? So I study salamanders a lot for that reason, but we can talk about it's the same three things. When they get injured, when we get injured, we have this massive inflammatory response, and then our body starts laying down scar tissue as like an emergency, I'm gonna say duct tape material, just to like stop the injury, okay? And we don't heal well because of a lot of that scar tissue. Salamanders have a very specific and controlled inflammatory response, and they can upregulate and downregulate that inflammatory response as they deem appropriate. And that's one of the things that allows them to create an environment that's much more conducive to new cells coming in and replacing that. Next, they actually have an algae that lives on them. What is algae? What is algae as a category? Is it an animal? No, what is it? It's a plant, right? What do plants produce? Oxygen. So there's a type of algae that grow on salamanders, and when they get injured, the algae migrate to the area of the injury and start producing unbelievable large amounts of oxygen in that area. So they're controlling their inflammatory response, they're upregulating their oxygen through the help of some, symbiotic microbes that live with them. And then the last thing that they do is they have a much stronger ability to upregulate and mobilize stem cells than what we do. But through those three main mechanisms, there's a few others, those are the three main mechanisms that make them stand out from most other animals on planet Earth that have this regenerative capacity. So I'm like, whoa, hey, if we can control the inflammation, if we can upregulate our oxygen, and we can mobilize stem cells internally, and or salamanders don't get to go to the doctor and get stem cell injections, but we can, right? So there's different ways to create a similar concept, you understand? But that's why the tools and the therapies and the strategies that we're using are so heavily focused on these categories. So one of the things that we'll be using here is photobiomodulation, and it's light therapy. But again, especially in places like here in the winter where we're not getting, let's say, full exposure to peak sun throughout the day and running around with in our bathing suits and getting a good amount of healthy sunlight, there are certain issues that our cells suffer from. Vitamin D deficiency is only one, and vitamin D is incredibly important for that inflammatory control. But the other thing that light does for us is it stimulates those mitochondria. So by using light therapies, we can upregulate our immune system, we can downregulate inflammation, and we can start upregulating energy production inside of our cells. And then hyperbaric, which helps to, by itself, downregulate inflammation, upregulate energy production. Hyperbaric by itself upregulates stem cell mobilization and growth factors inside of our tissues. So again, we have a number of tools that we can use here as part of the strategies as we're putting things together for you guys. But imagine we can combine them now. Instead of like red light does all this and oxygen does this. So hey, if you go down the street, there's a place where you can get some light therapy, and then come back here, we'll do some oxygen therapy, and then next Tuesday, go across the way. I heard that people in Stockholm really stay in their little nooks and crannies in Stockholm. Is that a thing? So you don't want to be running around to 10 different places to get all these different therapies. You want to create this synergy, and you want the synergy to be convenient, which I love the access component to the conversation for HBOT. So that being said, I just want to describe a little bit about what hyperbaric actually is, so you understand why is it so unique and why is it able to do what it's able to do. And then we'll get into some more of the programming, okay? So it's all about atmospheric pressure. Who's gone to altitude and hiking, skiing? Something, you guys all have, haven't you? Come on. So is it easier or harder to breathe as you go up in elevation? Harder. It's harder. Why? So everyone likes to say less oxygen, which is kind of true, but it's very specific. I'm a little, if you can't tell, I'm pretty nuanced with the words I like to choose. The air is 21% oxygen no matter where you are on planet Earth. So if you're at sea level, it's 21%. If you're at the top of Mount Everest, it's 21%. What you lose as you go up in elevation is pressure. And pressure is the driving force that allows you to absorb oxygen. Okay? So the reason as you go up, there's loss of pressure, every breath you take has less oxygen molecules, which is the driving force for pushing oxygen from the air you're breathing into your circulation. So it's all about oxygen molecule density, essentially, or concentration gradients. If you remember like 7th grade biology class, you put something like a little blue dye in a beaker and it starts to spread out, because things go from high concentration to low concentration, diffusion, if you remember that. But oxygen just follows the laws of diffusion. It's really quite simple. And so a chamber is the exact opposite phenomenon. You're not going up in elevation. You're creating a temporary environment where you're going below sea level. So inside that environment, we're just pressurizing the air or the oxygen, depending on what you're using. But as you pressurize that gas, every breath you take, you don't feel that pressure on your body, by the way, at all. You feel it in your ears a little bit, like you're on an airplane, your ears pop. But it doesn't feel like pressure anywhere else. But as you're breathing that pressurized air and that pressurized oxygen, every breath, you're bringing more molecules of oxygen than normal. And as you bring in a higher percentage of oxygen molecules, you're creating a larger gradient, pushing more oxygen into your circulation. And so that increased pressure drives that increased oxygen. If you've ever been to the doctor, they put a pulse oximeter on your finger. You've been there, right? So as long as you're healthy, your heart is healthy, your lungs are healthy, and you're at, let's say, sea level, you should expect a really high reading, like 98, 99% saturation, meaning right now in this conversation, just for you to listen to me talk, you are already carrying almost as much oxygen as you could possibly carry. But all of that oxygen is being carried on red blood cells, right? So red blood cells are the cells in your body that don't use oxygen, but grab it from your lung and deliver it to your cells. But they're floating in a liquid. That liquid is called plasma, and plasma, typically, like right now, plasma holds very little oxygen, 3 milliliters per liter, a very small amount. But as you increase the pressure in that chamber, you're going to saturate red blood cells. That's easy. But now you're going to drive oxygen into the plasma, which becomes almost an unlimited reservoir of excess oxygen that would be impossible any other way. And so that time you spend in the chamber, you are super saturating your blood many times over. So at the lowest pressure that I ever use in my office, not like, see he's 98% saturated, so under normal circumstances, he could only hold like 2%. The lowest setting we use in my office, we can get to 30%. And then depending on what pressure you're using, what percentage of oxygen you're breathing, and how much time, you can go up to 20 times, 20x. Like, it's enormous the amount of oxygen you could drive. Now, more isn't always better. There are specific amounts of pressure for different tissues, for different conditions, for different goals. But there's a wide range of anywhere between, let's say, 30% and 20 times the amount of oxygen that's available as a result. So this is what your blood would normally look like. There's one red blood cell, there's 4 binding sites, there's oxygen on each one. That's about as much as you could possibly carry right now. but under hyperbaric conditions, we're now flooding the plasma with that oxygen. So that's just a visual for you to see what it is that I'm talking about. So we reduce inflammation, so we have pain relief. We end up improving the healing mechanisms because we're upregulating stem cells and growth factors. We're getting more energy, reducing inflammation. When we talk about mechanisms of action are like, how does this thing work? Like, what does it do to people? And this is completely non-controversial. This isn't like Jason said these are the mechanisms of action. This is Jason went through all the literature on planet Earth. You know, there's over 2,000 studies on hyperbaric oxygen. What are the themes? What do we see over and over again? Like, what is a non-controversial explanation of what hyperbaric actually does to not some of the people that go in, all of the people that go in? And we could break it also into 4 categories: mechanical, hyperoxygenation, immunological, and regenerative. So depending on what we're trying to do, are we trying to control swelling and edema? Are we trying to increase immune system function or increase cellular energy? Are we trying to boost your immune system to fight infection or reduce inflammation? Or are we trying to stimulate healing, regeneration, and repair of injured tissues? So that's the thought process as we're using something like hyperbaric to really go through. And when we're talking about it in terms of most of our use of hyperbaric, it's really the mechanical effect is less important. It's those other 3 that we're really trying to tap into in order to make the changes that we're trying to actually make. And then, of course, then we're left with a whole series of benefits. Increased energy, balancing of the oxidative stress, upregulation of stem cells. You know, we're getting, to your point earlier, a lot of epigenetic changes that are shifting cellular responses to the environments that we live in. You know, increased levels of antioxidants, even just inside of our body, while we're decreasing inflammation and improving our immune system function. So I will leave it there for now, and then if you want to come and talk about some of the programs.
Yes. So based on this multi-therapeutic approach that Jason was a little bit talking about also, we have created programs to help you move towards better health. So our core programs or our core therapy in our programs is hyperbaric oxygen therapy. But we also offer other treatments through our programs through our clinic in Istanbul, and I will come back to this program shortly. So C stands for control. So we measure as much as we can before and after each of our programs to track results, modify programs, and base our recommendations accordingly. So as a doctor, I meet all the members before and after the programs. So we offer 2 types of programs here in Stockholm. The main one is our core membership program, where we include 30 hyperbaric sessions over a time period of approximately 3 to 4 months. And it is often combined with red light therapy prior to the hyperbaric oxygen therapy, since we think these therapies will potentiate each other, as Jason was mentioning. Then our members, of course, will have access to all the other therapies like sauna, cold plunge, cell gym, PEMF, AI massage as part of the membership. Our second program is a recovery program. This more intense and short program in terms of duration and intensity of hyperbaric could be an option after hard exercise, for instance, after running a marathon, or when being jet lagged, or after surgery, or if you have an injury of any kind. And then we have 3 programs which include therapies, which some of them cannot be accessed here in Stockholm. And these are provided through our clinic in Istanbul. And these programs are based on the assumption that hyperbaric treatment alone is great, but in combination with some other more advanced regenerative treatment can be even greater. And in Istanbul, we cooperate with VivoCell, a biotech company, which is dedicated to advanced cell therapies with a team of renowned researchers. And they have a GMP certified lab where our mesenchymal stem cells from umbilical cord and exosomes are developed. So our first Access Beyond program is longevity health optimization. That includes, as always, measurement before and after. And then we prepare the stem cell injections by doing hyperbaric oxygen treatments and double filtration plasmapheresis to optimize the results of the stem cell injection. So the injected stem cells actually can really focus on repair and regeneration. Then we have a second program for pain and orthopedic issues, where we combine hyperbaric oxygen therapy to stem cells and exosome treatment. And the program is individualized and is based on consultation with orthopedic specialists on site. We also have a program for skin and hair rejuvenation. We'll use PRP exosomes locally to reduce or stop hair loss, and if necessary, we combined it with hair transplant. Also, skin can be rejuvenated with a combination of hyperbaric, PRP, exosomes, and peptides. So this is our first chamber that very soon will be standing here.
Okay, we're almost about to take ourselves downstairs. We're going to enjoy some healthy food and some drinks. But before that, we need to introduce our final stage member, who will join us for a short panel where we can take some questions that we've prepared. And then, of course, I'm sure you have lots of questions. Let's take those downstairs to give folks a chance to mingle with one another. There's some amazing people here. But if I can introduce our final guest of the evening, Dr. Anders Kjellberg is one of the foremost researchers advancing hyperbaric oxygen therapy research for personalized medicine. So his work spans rigorous clinical trials, also specifically looking at things like long COVID and IVF as different ways in which hyperbaric can treat specific conditions. Always looking for biomarkers that help tailor treatments to the individual. He is part of steering committee for a major international trial on hyperbaric oxygen therapy. He's based here in the Nordics, and he shows that the region is stepping into global leadership on this field. So welcome, Dr. Kjellberg, and I do want to start with you. So you've published more than a dozen papers on hyperbaric chambers and their efficiency when it comes to treating everything from long COVID to soft tissue infections. So can you give us an overview of the ways that this established proven technology is being applied to conditions that we may be experiencing in the room?
Absolutely. I've been working in this field for more than 20 years. And what I've discovered is that everything we do, regardless of what condition that we treat, is actually connected to aging. Even when we heal a wound, the mechanisms are very, very similar to aging. That we have cells that don't work properly, and that we seem to collect old, tired cells that don't really function. And we need to get rid of them. Very similar to the salamander, we want to kind of renew the wound and bring in new stem cells and get rid of old cells. And that's really whatever condition that we do, even in the hospitals, in university hospitals, we use it in the same way, basically.
So very applicable broadly. Now, I was speaking with a Swedish founder of a bank a few weeks ago, and he mentioned that he has a hyperbaric chamber in his house. So, Dr. Helm, to you, are there advantages to doing this treatment with professional medical supervision, or is this something that everybody should have at their home?
Well, I think it should be clear from our discussion today here for the last hour that it's important to have combining the treatments, but also I think it's good to have discussion around all other topics. So in terms of if you have a chamber at home, that's you can do it, but I think it's good to combine.
May I just add one thing there, because I think this is an extremely important question, that first and foremost with hyperbaric oxygen is safety. Safety with the device. Then the longer lasting effects, that's something that is a bit unknown. But the safety with the chamber we know. Compare it to driving without a safety belt or biking without a helmet. It doesn't matter as long as you don't have an accident. But when you have the accident, which is rare, then it's the difference between life and death. That's why you should take this treatment in a clinic where people know what they are doing.
And I want to ask you a question now, Dr. Saunders, about this. So obviously, we haven't mentioned it yet, but hyperbaric, high pressure oxygen treatments have been around for hundreds of years now. We've been using this for centuries, right? I mean, what is it, 300-400 years, something like this. So when we're talking about normal, like healthy people, I know it's a spectrum, as you said, but when we're talking about a healthy person taking these treatments, are there any special considerations that you would take versus somebody that is recovering from, a difficult workout or any of these other symptoms of malnourishment?
Yeah, I mean, so hyperbaric has been around for over 300 years in a variety of forms. It's really, I'd say, has grown exponentially in the last 40 years and even in the last 3 to 5 years, beyond the last few decades. I would say that there are clear contraindications, for every therapy. There's not a single one thing that everybody should just do at will, whenever, at whatever pressure, at whatever time. There needs to be thought when you're building any type of program, whether it's from an optimization standpoint or it's from a recover from X, Y, or Z condition standpoint. Again, which is, I think, also why, as much as, that picture that showed all the different tools and toys and therapies, right? Sauna and cold, and these are all great, but you don't need to go in the coldest thing that's, you don't have to break ice and get into your cold plunge for it to work. It just needs to be really cold for you and whatever you're used to or whatever, starts to stimulate those changes. You don't have to go in the hottest sauna that is known on planet Earth in order to benefit from sauna. You need to go into something really hot that's uncomfortable, that makes you sweat, because it's all that building of resilience and adaptation that we were talking about. The more you do any of these things, the stronger, more resilient you get. But you have to be careful with all of these tools and thoughtful as you're building them. And I do believe guidance is necessary to say, listen, there are some things that you need to consider. So we're going to start over here, and as you trend and do better, we'll expand and push harder. Would you, I think, agree? I mean, it's a dynamic, transition of therapies over time. And I think with guidance is incredibly important.
And Dr. Kjellberg, I want to ask you, because of course, we don't, being a trained physician and also a PhD in the area, we need to be skeptical of over promises in this area. So what are the limits? Where does the hype sort of enter into the unknown? And what do we know? What is the limit of this?
We don't know for sure, but what we do know is that we can change cells from aging, or we can change the age structure of a cell type. That we know. I have seen that in my research. A lot of other researchers have shown it before me. And so we know that we can change certain cells. Whether that actually corresponds to us changing our sort of lifespan or even health span, that is actually not known at the moment. But with what we have seen in animal research and in cell models and cells within our own bodies, we know that we can change cells and rejuvenate a cell type that we know.
Dr. Helm, we heard about the multiple types of treatments, and Dr. Saunders made the analogy that 1 + 1 = 3, or rather that you can't keep a plant in the closet and expect it to heal itself. So can you talk a little bit about that combination that someone would get coming here to HBOT Stockholm? Like, what does that specifically look like in this context?
Yeah, well, so hyperbaric will be our sort of core treatment here in Stockholm. So that's, and then we can combine it with, for instance, infrared is a very good combination. But then, of course, we have all the other regenerative things like sauna and PEMF and cold therapies and so on. So the programs will be quite individualized, but we have in our core treatment, we decided to have 30 sessions of hyperbaric. And where does that measure come from? That's basically, we think that's sort of a good amount of sessions to really move the needle, because if you're going to do one hyperbaric, probably I don't know, what's your experience? You wouldn't feel that much. So you really need to do some sessions in order to really notice differences. And also, I mean, since we're going to track everything, we're going to measure biomarkers, we're going to measure performance, we're going to measure biological aging, and to really see is this what could be a good.
So someone's working with you to make a plan and then following these protocols to a certain extent, but there's also a lot of personalization.
Of course, and then there's things like lifestyle factors, of course, also that we're working on. So it's a combination in the programs.
And on those lifestyle and perhaps the personalized nature of these treatments, Dr. Kjellberg, we just talked about the 30 sessions. What does the research show with regard to, is more better of hyperbaric? Is there a limit?
Well, that is also a bit unknown, I must say. And it also depends on what you want to achieve. We know that one session can alter or make the outcome better for instance, in heart surgery. If you take one session before heart surgery, you improve the outcome in that surgery. But if you want, the 30 sessions actually comes from the studies from the 80s and the Marx protocol, when a physician treated rabbits with a radiation, gave them a radiation injury. And then he showed that it started to heal after 30 sessions. And then he treated them with 10 extra and it improved even more. So 40 has been like a standard sort of treatment session for many, many, many years. But because of convenience, patients don't want to come that often and it's expensive. He tried in the 90s with 30 and it also showed a difference. So that's really where these 30 sessions come from.
I'm super curious to hear the panel's thoughts on what do we think we'll be able to measure and prove about aging in the next 5 years? Because clearly what we're discussing here is the very safe and kind of, as you said, it's from either hundreds of years or the 80s or certainly lots of improvements in the last 5 years. But as we look forward to the next 5 years, what are the technologies that you're excited about, the protocols, the therapies? Maybe we can start with Dr. Saunders.
Sure. So the research I did a couple of years ago, we looked at inflammatory markers. We knew that was going to improve, but we didn't know, which ones over what period of time and how long. But that was expected. We also looked at, let me back up. Everybody in the study was non-diagnosed and asymptomatic, because I believe that most of us are chronically inflamed, and I believe that most of us are on an accelerated aging program on planet Earth. And so I wanted to see, could I take non-diagnosed, healthy Americans, in our case, and still move those needles. So we saw inflammation come down across the board. We saw cognitive performance improve almost in every factor. But the thing I was really interested was the epigenetic changes, because we know that the epigenome is essentially registering sort of our environment, our choices, our lifestyles, and it's signaling cellular behavior based on environmental factors. And we still know, this test was like 900,000 markers, and we probably know a few hundred of them, what they even mean. So I do believe that part of my excitement in the future is understanding the epigenome at a much deeper level, so that when we see these changes, epigenetic switches turning on and off, we understand what that actually means in terms of either moving someone from a healthier direction or away from a specific disease or reducing their risk of X, Y, or Z. So I think that's the next, even less than 5 years, the next year or two, we'll find out so much more.
So mapping the epigenome in a way. Dr. Helm, what are your thoughts on this?
Yeah, that's very interesting. Well, but I think with AI and how fast things are moving now, I think there's new type of like adaptive platform trials where you can test multiple things at the same time. You can test lifestyle factors, nutrition. You can take all these safe regenerative therapies, and you can rule out by doing interim analysis and keep the winners and continue. So I'm just curious to do better big giant trials where we can test all these different things that we think are working, but we don't really know, and both look at biomarkers but also look at endpoints like cancer, dementia, heart disease, death, of course.
Dr. Kjellberg, is something in the next 5 years you're really excited
what I have been hoping for the past 10 years of my research is to find a biomarker to individualize the dose, which we don't really have today. Because we can look at what happened after 30 sessions, but I would ideally have a biomarker that I can check on any of you before and after one treatment and say, am I giving you the right dose right now? And that biomarker we don't have today. So that's really what I'm sort of hoping on, to be able to more individualize the dosing.
I have one final question before we wrap up and give folks a chance to mingle. So I usually notice this tension between being an excellent communicator with compelling visuals and the ability to kind of captivate an audience, and scientific communication, which is almost by definition very robotic, and to your point, can do some kind of insane things with the randomized controlled trials, and has all of this I don't know kind of couching of nuance. So Dr. Saunders, you just gave a very compelling talk. What do you think are the limits of this kind of creating reality versus observing reality when it comes to health?
Yeah, I mean, living in the world of prevention or regeneration, it's like, well, if you didn't get it, how do you know that I was going to get it? Like there's a lot of, unknowns there. All we could really say is, in terms of patterns, and I'm always looking at patterns on people. We know that generally speaking, these markers, this lifestyle, these choices, these symptoms, like if we put all that together into a package of what somebody is coming in as, like we could start doing a pretty good job predicting the direction, where they are and the direction they're going. And then we could start looking from an ingredient standpoint, as I was saying earlier, here's their ingredient, like you're definitely getting way too much of this. Like there's toxicities here, there's deficiencies here. These are therapies that we know help this X, Y, and Z, and we can move them in the right direction. And we could say, man, we're making tons of progress, everything's good, and then somebody gets into a car accident and dies and they don't increase their longevity, right? There's no guarantees about anything, but what I would say is, I believe that everybody wants, most people don't even care necessarily how long that they live, but they want as good of a life as they can in the years that they have, right? Nobody wants, the age gap of health span being around 65 and lifespan being, 78 to 82. Like there's 15 to 20 years of rapidly declining health and rapidly declining quality of life. Nobody wants that. I think that we could all agree on. And I think that what we can really, I would say, promise is the better you take care of yourself, the higher the quality of life you will have in the years that you have. If you get lucky, we can push quality of life and longevity. But I think, longevity is harder to promise because a lot of other things can play a role there. Quality of life, I think, is much easier to influence from a day-to-day decision-making standpoint.
Well, excellent. Speaking of quality of life, we have an amazing downstairs reception for everyone, and give our panelists a thank you.